Have you noticed your eyes don't feel quite the same lately? Maybe they're drier in the morning, the newspaper seems increasingly blurry, or those dark circles just won't fade away. If you're over 50, you're not imagining things. But here's what most doctors won't tell you. These changes aren't inevitable. What if I told you that an overlooked remedy, sitting quietly on drugstore shelves for generations, could help support your eye health naturally? I'm talking about castor oil. And before you dismiss this as just another folk remedy, consider this. Castor oil contains unique compounds that penetrate deeper than almost any other natural substance, delivering inflammation-fighting properties directly where they're needed most. I'd love to know which city you're watching from. Drop it in the comments below, and don't forget to hit that like button and subscribe for more wisdom that respects your experience and intelligence. Now, let's explore what's really happening to our eyes as we age, and why it matters more than you might think. Let me tell you something most eye doctors won't mention during your brief 15-minute appointment. Our eyes age differently than any other part of our body. They're working constantly from the moment we wake until we close them at night. No wonder they show signs of wear and tear. What's fascinating is that there are two distinct types of changes happening in our eyes after 50. First, there are the natural changes we can't avoid, like our pupils getting smaller and lenses becoming less flexible. But then there are the preventable changes, the ones nobody talks about but that we absolutely can influence. Did you know your eyes have two different muscle systems? One set handles close-up vision, like reading your phone or threading a needle. The other manages distance vision, watching birds in your backyard or driving. Here's the problem. In today's digital world, we're overworking those close-up muscles while barely using the distance ones. Martha from Boston experienced this firsthand. "I spent 40 years as a librarian," she told me, "and suddenly at 68, my eyes felt constantly strained despite new glasses every year." Her doctor simply prescribed stronger lenses without addressing the real issue. Her eye muscles were completely imbalanced. What's even more interesting is how your brain's energy affects your eyes. When you're mentally exhausted at day's end, your vision literally suffers. That's why doing detailed needlework at 9 p.m. can actually damage your eyes over time, while doing the exact same activity at 9 a.m. can strengthen them. Try this simple practice. Every 20 minutes, look at something 20 feet away for 20 seconds. Eye specialists call this the 20-20-20 rule, and it works wonders for giving those distance muscles the exercise they desperately need. Your eyes weren't designed for constant close-up work. They need balance just like the rest of your body. When I mention castor oil, many people think of their grandmother's harsh remedy for constipation. But that's not what we're talking about here. The castor oil I'm sharing with you today is completely different. It's a gentle external remedy with a fascinating history dating back to ancient Egypt. What makes castor oil special isn't just tradition, it's science. The oil contains a unique compound called ricinoleic acid that gives it remarkable penetrating abilities. Unlike most oils that sit on the surface, castor oil can travel through multiple layers of tissue, carrying its anti-inflammatory properties deep where they're needed most. A 2019 study in the Journal of Ethnopharmacology confirmed what traditional healers have known for centuries. Castor oil reduces inflammation markers by up to 62% when applied topically. This is particularly important for eye health because most aging-related eye issues stem from chronic, low-grade inflammation. Dr. Elizabeth Johnson, an ophthalmologist with 30 years of experience in geriatric eye care, was initially skeptical about castor oil. "I was trained to dismiss folk remedies," she admits, "but after seeing consistent improvements in patients using castor oil externally, I began researching it myself." She now recommends it as a complementary approach for patients with early-stage cataracts, chronic dry eye, and lid inflammation. When choosing castor oil for eye health, quality matters tremendously. Look for cold-pressed, hexane-free, organic castor oil in dark glass bottles. Avoid products with additives or fragrances. A high-quality oil will be pale yellow to nearly clear with a mild, slightly nutty aroma, nothing sharp or chemical. Many mass-market oils undergo harsh processing that destroys their beneficial properties. Most remarkable is castor oil's versatility. While conventional treatments typically target just one symptom, castor oil addresses multiple eye issues simultaneously. It hydrates dry tissue, reduces inflammation, improves circulation, and even helps clear cellular waste that contributes to conditions like cataracts. And unlike pharmaceutical options, it accomplishes this without disrupting your body's natural processes. Before we delve into specific eye conditions, remember this: castor oil isn't a replacement for medical care, but rather a gentle support that works with your body's innate healing abilities. Now, let's explore exactly how it helps with 5 common eye problems that affect millions of Americans over 50. Let's talk about what you're really here for: how castor oil can help with specific eye problems that might be bothering you right now. I promise to keep this practical and straight to the point. First up is dry eye syndrome, that scratchy, burning feeling that makes you reach for eye drops multiple times a day. After 50, our tear glands naturally produce fewer tears, and the quality changes too. The tears evaporate too quickly, leaving your eyes feeling like the Sahara Desert by noon. Here's where castor oil shines. Unlike artificial tears that wash away within minutes, castor oil creates a lasting protective barrier that actually helps your natural tears work better. Jean from Denver tried everything for her chronic dry eyes: prescription drops, humidifiers, even special glasses. Nothing worked for more than an hour, she told me. Then she started applying a tiny drop of castor oil to her eyelids each night. Within a week, her morning dryness disappeared. By month 2, she'd cut her daytime drops in half. Next is early-stage cataracts, those cloudy spots forming on your eye lens that make driving at night increasingly difficult. While advanced cataracts require surgery, research shows that inflammation accelerates their growth. The anti-inflammatory properties in castor oil can potentially slow this process when caught early. Robert, a 72-year-old retired teacher, was diagnosed with early cataracts, but wasn't ready for surgery. My doctor said we could wait, but they were definitely getting worse. After 6 months of nightly castor oil application, his follow-up showed the cataracts hadn't progressed. His doctor was surprised enough to make a note in his chart. Then there's those stubborn dark circles and crow's feet that make you look perpetually tired. The skin around our eyes is incredibly thin, just half the thickness of the rest of your face. Castor oil's unique fatty acids help strengthen this delicate skin while improving circulation to reduce puffiness and dark circles. The fourth issue is eye strain and fatigue, especially if you spend time on computers or enjoy reading. Castor oil helps by reducing inflammation in the tiny muscles that control focusing. Many users report their eyes feel more flexible after regular use, like they've had a gentle massage. Finally, for those managing glaucoma with medical treatment, some eye specialists now suggest castor oil as complementary care. It may help reduce pressure by improving the drainage of fluid from the eye. Important note: this is never a replacement for your prescribed glaucoma medications, but rather a supportive addition, always with your doctor's approval. Now, I'd love to hear which of these issues concerns you most. Drop a comment below. You might be surprised how many others share your experience. Now, let's get practical. I'm going to walk you through exactly how to use castor oil for your eyes, because doing it correctly makes all the difference in the world. Let's start with your nighttime routine, which is when I recommend most people begin. About 30 minutes before bed, wash your hands thoroughly. This isn't the time for shortcuts. Then take a single drop of castor oil. Yes, that's all you need. Onto your clean fingertip. Gently rub it between your index finger and thumb to warm it slightly. With your eyes closed, softly smooth the oil across your eyelids, paying special attention to the lash line. That's it. No complicated techniques or equipment needed. The oil will naturally migrate where it's needed during the night. But wait, you might be wondering, do I put it directly into my eyes? This is where people get confused. For beginners, I recommend starting with external application only, just on the eyelids. Some experienced users do place a tiny amount directly into the eye, but this should only be done after consulting with your eye doctor and using a sterile dropper. Margaret from Florida learned this the hard way. I got too ambitious, she laughed when telling me her story. I put way too much oil directly in my eye the first time. I couldn't see clearly for hours. Now she uses just a fraction of a drop on her lids and has seen remarkable improvement in her chronic dry eyes. Start with applying it just 3 times a week, then gradually increase to nightly use if your eyes respond well. Most people notice first results within 1 to 2 weeks, with more significant improvements by the 1-month mark. A few important safety notes. Never use castor oil if you have an active eye infection. If you wear contact lenses, remove them before applying the oil and wait 8 hours before reinserting them. And if you're currently using prescription eye medications, apply those first, wait 30 minutes, then use the castor oil. What about potential side effects? The most common is temporary blurry vision if too much oil enters the eye. That's why less is more. If you experience any irritation, redness, or discomfort that persists more than an hour, wash your eyes with clean water and discontinue use. I'd love to know, would you feel comfortable trying the external application method first, or do you have questions before getting started? Share your thoughts in the comments. While we've focused on eye health, I'd be doing you a disservice if I didn't mention how castor oil can support your entire body after 50, especially when those small discomforts start adding up. Let's start with something that affects nearly half of all Americans over 60, digestive issues. Whether it's occasional constipation, bloating, or that heavy feeling after meals, a castor oil compress on your abdomen can work wonders. Unlike taking it internally, which I don't recommend unless directed by a doctor, a compress allows the oil to gently penetrate your tissues, reducing inflammation and encouraging normal movement. Frank, a 68-year-old veteran from Arizona, had struggled with irregular bowel movements for decades. It was embarrassing and uncomfortable, he told me. After using a castor oil compress 3 evenings a week for a month, he experienced what he called the most normal digestive rhythm I've had since my 30s. The women in my audience might appreciate knowing that castor oil also supports hormonal balance during and after menopause. When applied as a warm compress over the lower abdomen, it helps stimulate circulation to reproductive organs and supports lymphatic drainage, which can ease many uncomfortable symptoms of hormonal transition. Joint pain is another area where castor oil truly shines. The same anti-inflammatory properties that help your eyes can bring remarkable relief to stiff, achy joints. I personally use it on my knees after gardening, just a quarter-sized amount massaged into each knee before bed. Carol from Michigan combines her castor oil treatment with movement. I apply it to my arthritic hands, put on cotton gloves, and then do gentle finger exercises. The difference is night and day. I can now open jars and button shirts without pain. For those who've had surgeries or injuries, castor oil can help soften and reduce scar tissue. This is especially valuable for women who've undergone breast surgeries. The oil helps break down fibrous tissue while improving circulation to the area, often resulting in less pain and restriction. What makes castor oil different from other topical remedies is how it works with your body's own healing mechanisms, rather than overriding them. It doesn't force a quick fix. It supports your natural processes, which is exactly what we need as we age. Our bodies don't need harsh interventions. They need gentle support and the time to heal from within. I'm curious, which of these whole body benefits sounds most relevant to your life right now? Let me know in the comments. Let me show you how to make a simple castor oil compress. It's easier than baking cookies and costs less than a cup of fancy coffee. This method works for all the applications we've discussed, whether for your eyes, joints, or abdomen. First, gather your supplies. You'll need cold-pressed castor oil, the same one you use for your eyes, a clean cotton cloth, an old t-shirt works perfectly, a small piece of plastic wrap, and a towel. For eye treatments, you'll only need a drop or two, but for larger areas like your abdomen or knees, keep about 2 tablespoons handy. Start by folding your cotton cloth into a rectangle that comfortably covers the treatment area. For eyes, a small 2 by 3 inch cloth is plenty. For your abdomen, you'll want something closer to 8 by 10 inches. Drizzle the oil onto the cloth, not so much that it's dripping, but enough to saturate the center. For eye treatments, you can simply place the cloth over closed eyes for 10 to 15 minutes while you relax. For larger areas like joints or your abdomen, place the cloth oil side down on your skin. Cover it with plastic wrap to protect your clothing. Then place a towel over everything for warmth. Some people like adding a heating pad on low setting, but your natural body heat works just fine too. Rest with the compress in place for 30 to 60 minutes. The perfect excuse to listen to music, meditate, or watch your favorite show. I usually do my abdominal compress during the evening news. Betty from Ohio was initially confused about reusing her compress. "Do I need to make a new one each time?" she asked me. "Not at all. After use, fold your cloth with the oily side in, place it in a glass container or zip-top bag, and store it in a cool, dark place. You can reuse it 3 to 4 times before washing it. Simply add a few more drops of oil to refresh it before each use. One common mistake is using synthetic fabrics like polyester, which don't absorb the oil properly. Natural fibers like cotton, flannel, or wool work best. Another tip: if you accidentally get oil on clothing, pre-treat with dish soap, not laundry detergent, before washing. For those with sensitive skin, do a small patch test first. Apply a tiny amount of castor oil on your inner arm and wait 24 hours to ensure you don't have any reaction. What other natural remedies have you tried making at home? I'd love to hear your experiences in the comments below. We've covered quite a journey together, from tired eyes to aching joints and everything in between. Castor oil isn't a miracle cure. It's something better. A gentle, natural tool that respects your body's wisdom and works with it rather than forcing change. What I love most about castor oil is its simplicity. No complicated regimens, no expensive equipment, just a small bottle of oil and consistent care. Remember, healing happens in its own time. A single drop, applied with intention night after night, can create changes that accumulate quietly and profoundly. Always consult your doctor, especially if you have specific eye conditions or are using prescription medications. But don't be surprised if you discover something your grandmother knew all along. Sometimes the gentlest remedies carry the deepest healing. I'd love to hear from you. Which issue will you try castor oil for first? Your eyes, joints, digestion, or something else? Share your journey in the comments below.